The CEO or the COO needs to know that the biggest expense over the lifetime of a building is the people in it. It is therefore worth spending money to create well-being spaces that give options for all different kinds of people.
Welcome to the Optimized Workplace. I'm your host, Fran Dean Bishop, where our discussions with influencers, experts, and innovators are helping transform the well-being and sustainability of today's workplaces and spaces. Today, I have the esteemed pleasure of welcoming Dr. Esther Sternberg, an internationally recognized, incredible writer and author of my now famous and favorite book, Well at Work, internationally recognized for her discoveries in the science of mind-body interaction and illness and healing, and the role of place in well-being. She currently serves as research director at Andrew Weil Center for Integrative Medicine and founding director of the University of Arizona Institute on Place, Well-being, and Performance. Welcome, Dr. Sternberg, to the show.
Thank you. Thank you so much for that wonderful introduction and for being such a fan of my book. I'm so thrilled.
Oh, I have been looking forward to this. I could hardly sleep last night. Things like this get me really blow up my skirt. I get so excited because I love well-design and well-being, and everybody that listens to the show knows I live in this world. And so just to read an author who so well articulates and makes it so relatable and palatable so that people who sit outside the well-being and well-space design world can understand it is just amazing. This is a really incredible book. Everyone should grab it.
Well, that means a lot to me. Thank you so much.
Okay, well, let's get this underway because I have so much to ask you about. One of my favorite quotes from your book, which I'm preceding this with, why do you wrote this book now in this age? I understand it, but I'd love you to explain to our listeners. But one of my favorite quotes from the book is where you really break down well-being. And you say, well-being can mean different things to different people. In the field of integrative medicine and integrative health, it's holistic, whole person health, both mental and physical, encompassing the 7 core areas: stress, resilience, movement, sleep, relationships, environment, nutrition, and spirituality. So particularly at the work with what you're doing now at the Andrew Weil Center for Integrative Medicine, why now? Why this book now? Why do you feel it's not only trending, but it's so important for people to understand this wonderful crossroads of well-being and well-space?
Well, I've been working on this in this field, actually with the U.S. General Services Administration. You're based in D.C., and I believe you know a number of people there. And one of the key characters in the book is Kevin Kampshire, who is Director of High Performance Federal Green Buildings and Chief Sustainability Officer for the GSA. And we started working together when I was at the National Institutes of Health in the year 2000. So we've been working together for about 24 years. And back then, it was not a priority for organizations to design or operate their office buildings for health and well-being. It just wasn't at the top of the Excel spreadsheet for spending. But Kevin Kampshire back then, and I tell this story in the book, I like to say that the book is like a sandwich. The first part is about the characters and the people whom I worked with over the last decades. To use wearable devices to measure the impacts of the built environment on many environmental attributes on health and well-being. And Kevin Kampshire came to me back then in the year 2000 when he was research director for the GSA. And he asked me, he knew I was working at NIH on stress and the stress response. And he asked me if I could help him measure the impact of the office spaces that he oversaw for over 1 million office workers, over 374 million square feet of office space, to know how to design those spaces and operate them to keep the people in those spaces happy, healthy, and of course, productive. And that's when we started way back then using wearable devices. We published a study in 2010 in a building in Denver that was a federal building that was being retrofitted. And we measured heart rate variability, which is what your usual wearable devices for health tracking measure for the stress and relaxation response. But back then, the wearable devices were about the size of a landline phone with wires glued to your chest. And we had the workers wear these for 2.5 days, even when they went home at night. And we also collected the stress hormone cortisol from their saliva. And much to my surprise, and I don't know why I was surprised, the people in the old unretrofitted workspace that had 6-foot high wall cubicles, it was dark, no views to the outside, no sunlight, circadian light. It had high mechanical noise. It was musty. Those workers were significantly more stressed, even when they went home at night, even while they were sleeping, by these measures, these objective measures of the stress response, than when they were in the new retrofitted, beautiful, light and airy open office design with views to the outside and lots of sunlight and low mechanical noise and good airflow. So I don't know why I was surprised, except that people and I took for granted the spaces in which I worked and did not realize how much they impacted my stress response and my well-being. Because when we asked those workers whether they felt stressed or not, they were not aware that they were stressed in the old space. Yet the stress levels that we measured were in the medically relevant range. So when I left NIH and came to the University of Arizona in Tucson in 2012, Kevin asked me to continue these studies, but using state-of-the-art wearable devices. And we pulled together a team of researchers, engineers, psychologists, architects, and medical experts and big data analytics experts to use state-of-the-art wearable devices to measure the impacts of, we ended up studying about 270 workers in 4 federal buildings around the country. And in the book, I described these collaborators. And when my editor first read the draft, she said she loves that part of the book because it's like I'm setting up the Marvel universe. So my colleagues now love to be called the Marvel universe. So, but we again found the same thing, basically, that spaces can either stress or calm, and people are not aware of it. And so what our research did is it provided Kevin with a prescription for a healthy well-being building. And then COVID happened. You asked me why now. Well, first of all, we all have been advocating to design healthy well-being buildings, not just healthy, not only physical health, but for emotional well-being. We've been advocating this for a quarter century, but until COVID, it was not front and center top priority for organizations. And then suddenly, yes,
bam, let's do it. Let's do it.
Right. And I know you interviewed Rachel Hodgson last week, CEO of International Well Building Institute, and I'm sure she told you how the demand around the world for labeling buildings as healthy and safe skyrocketed to billions of square feet of office space. And because people...
That's such good news, though. That is such incredible good news.
Yeah, it's a silver lining of COVID, because people didn't want to go back to work.
And they still don't. They still don't. I mean, I think that what you're saying, the well-being standard and being able to walk into a building and seeing that label is a major driver for people, especially into Washington, D.C., where we have these old legacy behemoth buildings that have been here for decades, if not a century, right?
Right.
People are like, okay, you want me to go back in there? You know where we just came from. I haven't forgotten, Mr. Employer, Mrs. Employer. So what's in it for me, right? Besides a paycheck, because it could affect my health for the long term. Great point.
Right. And so my point, so we all became aware of the importance of ventilation, right? During ventilation and filtration during COVID, you saw all those animations on the internet about the virus spewing out through the vents and so on. But the thesis that I make in the book is, in order to get those people back to work, and Forbes did a survey in the summer of 2023 where it showed that 98% of workers want to work hybrid. Some over 60% would change jobs or consider changing jobs if they can't have a healthy workplace, if they can't work hybrid, and somewhere over 30% will ask for a pay cut in order to work hybrid. Now that tells you something. People, and I talk about the downtown apocalypse in the books where, and this in DC, that the downtown is shriveling because people are not there during the day, and local shops and restaurants and bars and so on are shuttering. So my thesis is you've got to do more than ventilation. You absolutely have to do
100%.
You have to have clean air, you have to have frequent air turnover, you have to have excellent filtration. But whether you get sick from a virus or from anything depends on the dose to which you're exposed, the duration of exposure, and your own resilience. And ventilation and filtration can reduce the dose to which you're exposed and the duration of exposure. And so can masking and distancing. But in order to be your healthiest you need to be resilient. And the whole thesis of the book is that in order to be resilient, you need to engage in the 7 domains of integrative health as defined by the Andrew Weil Center for Integrative Medicine: sleep, resilience, environment, movement, relationships, spirituality, and nutrition. And that's the middle part of my book, the sort of sandwich. There are 7 chapters, which shows you how to do that.
I want to interject here because I think you brought up some really powerful points that, again, if you all are listening, to really circle back to, 90% of our lives are spent in a built environment. So if 90% of your life is spent in a built environment, it is completely inconsequential for you to think that that built environment could not be having an either really positive or detrimental effect on your health, as Dr. Sternberg just pointed out. In addition to the Forbes article, there was a really interesting study that both MIT and Stanford did about how productive people are in working in an office versus working at home. And you're absolutely right. The conclusion was hybrid workplace functions work best, right? So having a hybrid environment, whether you're 2 days in the office and a couple of days at home or vice versa, come into the office for collaboration, but that space needs to really be serving the population when they do come into the office. If it's the same vanilla shell, poor ventilation, bad lighting, all of that, then it's not going to change the trajectory. But I want to get into something that you mentioned from your book, and I'm going to quote it directly, and I'd love to hear your lens on this in terms of, again, the integrative medicine component and how it really feeds the environment. So you quote in, I think it's within the first or second chapter, you said, ideally, work environments should be built to vary and to provide optimal conditions for every individual in them at all times. And then you drop down and you say, the concept of individualizing treatments for health is not new. Whether you realize it or not, your healthcare provider may already be practicing personalized medicine in the drug combinations and doses that you are prescribed that are determined by your individual genetic and metabolic makeup. This is the point I love. So why not apply that same kind of personalization to our surrounding environments, not just to prevent illness, but also to promote wellness? Since everyone reacts in their own way to different environmental stimuli, rather than creating uniform conditions based on statistical averages that don't work well for anyone, individual spaces need to be tailored for individual comfort. So with that thought in mind, if you're a CEO or a COO, or maybe you're a facility director at one of these many locations around the Beltway that we're speaking about, how can an employer or an agency director begin to think about, okay, so how do I meet with my architect or my planning team to even begin to make some inroads of this? If I can't collapse the building and start anew, how do we begin the conversation, Dr. Sternberg?
Wow, that's a big question. So, this is where the bottom line comes in. that the CEO or the COO needs to know that the biggest expense over the lifetime of a building is the people in it.
Mhm.
And it is therefore worth spending money to create well-being spaces that give options for all different kinds of people. Neurodiversity, people who are more introverted, people who are more extroverted. In our studies, we actually found that people who were more introverted were more focused or felt they were more focused and they were happier in their spaces when they were sort of more private, more enclosed, and people who were extroverted were happier and in open office setting where there was more bustle and stuff going on. You look at the people working in coffee shops and they're probably the extroverts because they actually thrive on that energy. So you can't survey every office worker and say, okay, if you're introverted, you go there, and if you're extroverted, you go there. That would be a terrible thing. But what you do is you have lots of different spaces where people can go according to their own preference. So if you look at the GSA headquarters of 1800F, and I describe this in the book, there's lots of places where people can go to sit. They have their own open office bench seating, but they can go up to the roof area and they can sit outside on the roof deck, or they can sit in what's called the cafe, which is right next to a whole lot of windows near the roof deck where you can see the monuments and the mall, and it's just beautiful. And some people prefer to sit there, or they can sit in quiet rooms, or there are rooms where there's small spaces for gathering for fewer people, or larger rooms where more people can gather. So you need to create spaces where people can go according to their preference, according to their personality, according to their needs, and according to the type of work they're doing. I mean, throughout the day, sometimes you need to do heads down work and be quiet and be in a library setting. Sometimes you need to be with others. And in fact, it comes to the main crux of where we are in this moment. We're at an existential moment in trying to define what is the purpose of those crystal palaces, those skyscrapers in all the downtowns. Why go there? And the answer is for interacting with other people. Because the other thing that has been found is that if you are working from home or alone the whole day with back-to-back Zoom or video conferencing, there's burnout. There's about 67, again, the Forbes study showed about 67% burnout from working solely from home. And when you go into work, you get that sustenance of relationships. So talking about the relationship piece of the 7 domains of integrative health, you get that from being in person. We are social animals, and rather than being burned out, you get energized and creative with bouncing ideas off people in person.
I love that. And it also gives people a reason to feel alive. Like you said, I mean, there's so much, I live in downtown Washington. There's so much energy in that urban, robust environment. There's people moving, there's people biking, there's people skateboarding. I mean, there's just a lot of energy in that you don't get with your 20-second commute. Like, it's not going to happen, right? Unless you're jumping off the walls or something like that, or the kids are home, and then that's a whole nother level of energy you probably don't want, right? But you're right. And just today, this is our cherry blossom season in downtown DC.
Oh, I wish I were there.
Yes, DC is full of tourists, but the tourists do make you slow down as a resident and observe what's around you. The trees are budding. It's 75 degrees. DC is a glorious place to live in at this time of year. It's just epic, right? Everything is just budding and the sun is bouncing. I mean, it's just wonderful. But you're right. That's not going to happen if you're at home in a secluded or quiet community on your own. You need to be in that engagement space. Right. So as we round the corner, I knew this conversation would go fast. I told you that from the top of the hour. I'm already setting the stage to have you come back. And the next time we have you come back, I really want to delve into what your favorite feature is of the built environment, and really trying to, your favorite concept, I should say, of the new built environment and what that looks like in the future. But I'd love you to share a little bit, a glimpse of your second chapter where you talk about stress and resilience, finding calm in chaos. If you, again, are a leader that is really taxed with a team that has gone through the burnout and gone through the stress, and you found out the hard way that resilience was not part of their, way of life. How do you begin to shape a future of new? The future of work is a big, term right now that we're hearing more and more and more. How do you begin to, I'd say, broker this conversation with your team in coming back and reshaping, or even with leadership in terms of creating this new space in this new environment, or this, again, finding the calm in chaos?
Well, I think you just captured it in creating it with your team. It is essential to work together to find the optimal workspace, the optimal combination of what everyone wants. Because, there's going to be people who prefer heads down, dark spaces, and there's going to be people who prefer light, bright, airy spaces with lots of movement and activity. But you need to work with everyone and understand that you are all in this together. And I think that one of the things that's important for the CEOs, for the people at the top, to realize is that it's not good to burn the candle at both ends. It's not good to be not sleeping. There's studies actually that show that people who have problems sleeping from whatever cause can cost an organization between $1,500 and $3,000 per person per year. If you have a lot of people in your organization, that's a lot of money.
Yes, it is.
And in order to set the tone, the leadership needs to understand that in encouraging their workforce to engage in these 7 domains of integrative health, they will have a healthier, happier, more committed workforce, and in the end, be more productive. So working together, setting the tone, setting the example of engaging these activities, work-life balance, and so on, is really essential. And then everybody will be happy and less burnt out and more productive.
Well, I think that's a fantastic place to pause. We're going to put a pin in it, but this won't be our last conversation. If you didn't catch the top of the show, please pick up Dr. Sternberg's book, Well at Work. As you can see, it's very earmarked on my end. I'm enjoying it so much. It is just a phenomenal read. I loved it from beginning, and I'm nowhere near the end. So thank you, Dr. Sternberg, for being with us today.
Thank you so much. It's been a joy and a pleasure to talk with you, Fran. Thank you.
Absolutely. And thank you all for joining us for the Optimized Workplace. I'm your host, Fran Dean Bishop. And remember, like I always tell you, it's many, and that's small, monumental moments that make the biggest difference in your life. So pay attention. Pay attention to how you move, how you work, how you live. I'm Fran. Take care, everyone.